I'm Tracy Wynn, and I'm going to walk you through what to expect at your first Invisalign appointment. You should have already received a consent form. If you have any questions to that consent form, let us know. The first thing that's going to happen at your appointment is we're going to show you the Invisalign ClinCheck simulation. So Invisalign designs a simulation, so there's this algorithm where it designs certain movements. The doctors of Lansdowne Dental Care will be tweaking these movements. What we're going to show you is the final product. You're going to see that some of your teeth may need buttons, you may need elastics, you may even need mini implant screws to help with the movements. One of the things too that we're also going to talk to you about is the use of Munchies. Munchies are that tri-lobe appliance that we give you that you chew on. The goal of Invisalign is to activate those buttons. So when you put on the tray, you're going to put on the Munchies pretty much about for 15 minutes right when you put it on. Do that 3 times a day. So in between, after you eat, you're going to clean out your trays, you're going to put it back in, and then you're going to do your Munchies. Now, my protocol is a little bit different than other offices. I want you to chew with the Invisalign. Yes, that sounds kind of nasty, but trust me, it works. If you really think about Invisalign and braces, you don't take out the brackets and wires to eat. The thing with Invisalign is the more you take out the trays, the higher the chance of you losing it. And 2, you're really not functioning in these trays. You're just speaking in the trays. So I actually want you to function and eat, do everything with these trays. Yes, it's gonna be nasty, but just take it out after you eat, brush it, clean it, put it back in, and then do your Munchies. You may need what we call Propel. So what is Propel? So the older you get, the bone is a lot more dense. With the bone being a lot more dense, it's harder for tooth movement. So what Propel does is we basically just release the resistance in the bone. I have another video that goes more in depth, but we will talk about if you need Propel or not. And lastly, we will give you an aligner schedule. Now, everyone's different, everyone's movement is different, so sometimes I may request for you to change your trays every 3 days, every 7 days, or sometimes every 14 days. So please pay attention to your aligner schedule. And your aligner schedule is coordinated with the aligner that you are currently wearing. So, again, what to expect at your first appointment. We're going to review the ClinCheck, so you're gonna see all the movements, and if you have any questions, we're gonna talk about the buttons that we put on your teeth. We're gonna talk about elastics for bands, if we need any mini tads. We're gonna talk about Propel, if you need Propel. And we're gonna give you an aligner schedule and 2 Munchies. Thank you.